So welcome to our Immunize Colorado education series. My name is Sara Warniak. I'm our program director. And our topic today is back to school health, understanding current immunization data and state guidelines. And I will introduce our presenters a little bit later. A little bit of housekeeping. So if you've been here before, you know, webinar attendees are automatically muted and off camera for the duration of the presentations. If you're having any difficulties or questions, please put them in the chat box. You can chat with hosts and panelists. We will be conducting Q&A at the end of the presentations. So if you have questions throughout or at the end, you can put questions in the Q&A box or in the chat. We'll see them in either. We'll have a post-event evaluation after the webinar. It's really helpful to us if you fill that out. It'll be up on your screen in your chat, and it'll be sent in a post-webinar email. And then the recording and slides will be available on our website within a week of this presentation. If you have any colleagues who missed today, be sure to share that with them. So who are we? We're Immunize Colorado. We were founded in 1991. We're formerly the Colorado Children's Immunization Coalition. We're a statewide 501c3 nonprofit that serves to protect Colorado families, schools, and communities from vaccine-preventable diseases. A little bit or a few announcements from us. First, we have a motivational interviewing training that we would love to come give you for free. We can come and provide a tailored training on how best to speak to parents and patients about vaccines. It's great for providers and community members alike, in person or virtual. We go all across the state. It's 1.5 to 2 hours, super interactive. Email me if you'd like to schedule one. We are also looking for parent testimonials for a campaign we have called Parents Talk. This one is specifically the flu edition. It features real parents and other caregivers that share why vaccines are important to them and their families. So if you're a parent or a caregiver and you're interested in sharing a testimonial, there's a QR code on the screen and a link in the chat with instructions for how to do that. We would really appreciate it. We have a September webinar already planned. I should have put the dates on the slide, but that's okay. I believe it's September 14th. It's on universal vaccine purchase, which there's a brief description on the slide. If you're interested in signing up, this QR code will take you to the registration and also a little bit more of a description so you can learn a little bit more. And there is also a link in the chat. And last but not least for our announcements, we have a couple of save the dates for you. So first, by popular demand, our Regional Immunization Summit is coming back in 2027. We're tentatively scheduled for June 7th and 8th, so mark your calendars. And we'll be returning to Hotel Colorado in Glenwood Springs. And then second, we have a community baby shower coming up in Colorado Springs. This is a big kind of healthcare event, health fair situation with a focus on the prenatal to 3 population. That's October 24th, 2026 from 10 to 1 at Hillside Community Center in the Springs. We're still actively recruiting exhibitors, volunteers, and people who would like to get involved. So if you're interested in learning more, you can email me. All right, and now it's time to turn it over to our presenters. So first up, we have Sara Lopez. So Sara is the School and Child Care Nurse Consultant at CDPHE. She is part of the Clinical Resources Unit within CDPHE's Immunization branch. She provides clinical consultation, technical assistance, and interpretation of the immunization schedule and Board of Health rules. She has over a decade of public health experience working for both local and state agencies. Her background includes immunizations, infectious disease, childcare, and Head Start consultation, early intervention, emergency preparedness, and maternal and child health. And then we will also have Rachel Severson. So Rachel is the Immunization Branch Data Unit Manager and has worked in the Immunization Branch since 2018. Her work involves utilizing Colorado Immunization Information System, or SIS, data to develop and supervise Colorado's immunization data analyses, infrastructure, and governance. So without further ado, I will turn it over to Sara and Rachel.
Thank you, Sarah. Next slide, please. So we're going to kick off our presentation with an agenda, just to let you know what to expect during the next hour or so. So we're going to do some level setting, first on school immunization requirements, ensure we're talking and using the same definitions and have a broad understanding. Then we're going to go over CDPHE's immunization data dashboard, an overview of Colorado and US school immunization data, strategies for back to school, and ending with some resources. So to kick us off, immunization requirements for school entry. So these are state-based school immunization laws. They exist in every state and are a key public health strategy. We think of these requirements as a system of prevention working year-round to support high vaccination coverage and low rates of vaccine-preventable disease. Colorado Board of Health Rule 6 CCR 1009-2 establishes the immunization requirements for students attending school in a wide array of settings, including childcare facilities, camps, Head Starts, K-12 schools, and higher education facilities. The rules specifically cover immunization requirements for students attending school, the exemption processes, what's required for documentation, the requirements around denying attendance of a student that's not in compliance with the rule, record keeping and reporting, and other related rules. So to look at this specifically, for the parent or guardian's responsibilities, before a student's first day of school, Colorado law requires that they provide for each school their child attends at least one of the following documents. So the first is, and by and away the most common, is an immunization record showing that the child has received school-required vaccines and is up to date according to their age, following the timing and spacing intervals of the evidence-based immunization schedules. Next. The second way is an in-process plan. So this is a document. We have a sample on the page here, but it can come and be written by any provider, but signed by a student's healthcare provider, showing that they're in the process of catching up on missing vaccines, following the minimum medical intervals between doses described in the catch-up schedule. And in our rule for school-age children, that's the American Academy of Pediatrics catch-up schedule. Then the final way a student can be in compliance is providing a certificate of medical or non-medical exemption for any missing doses of school-required vaccines. So to meet these requirements and be considered in compliance with the law, students may have one or a combination of these documents for the various different school-required vaccines. So if we have maybe a 3-year-old attending childcare, their child care's immunization file could contain an immunization record showing they're fully immunized, up to date for their age for Hep B, DTaP, Hib, pneumococcal, and polio vaccines. And then they could have a certificate of non-medical exemption for MMR, and then maybe an in-process plan showing they're catching up for varicella. Hib and pneumococcal vaccines are not required for K-12 schools. Just a note on that. Next slide.
And I think I'm going to take over here. So like Sarah mentioned, there's a state board of health rule that requires most schools and licensed childcares in the state to report aggregate immunization and exemption data to CDPHE annually. So that data collection process that we manage through Skitter reflects those individual schools' work to collect immunization records and also enforce the immunization requirement. So that annual collection process opens each year on October 1st and closes on January 15th. And another note about the overall data collection process is the data that we collect from each school and childcare represents a single point in time snapshot of student enrollment and their corresponding immunization records at the time of reporting. So in addition to the compliant categories that Sarah mentioned, a school or childcare will report its non-compliant students' immunization documentation in 2 ways. One way is if the student has an incomplete record. So incomplete record refers to students with incomplete immunization records. They have records for the school required vaccine, but the records are missing one or more doses. This status could also apply to students with incomplete certificates of exemption. So the exemption may have expired, it might not be signed, or it's not on the appropriate form. And then the second category of non-compliant students is students with no record. So these students have no immunization documentation, no exemption documentation, and they don't have an in-process plan in place for all school-required vaccines. So in other words, the immunization file for these students is blank. So there is more information on CDPHE's immunization requirements for school entry webpage, and that outlines Colorado's official immunization requirements.
Okay, so let's do, we're going to go over the requirements in action. So some of you may be quite familiar with these rules and some less so. So Sarah's going to be launching a poll in a moment. And if you're not sure, it's anonymous, make your best guess. So we're going to go through a scenario about Henry. He's a 9-year-old. He's newly enrolled in elementary school. The immunization record provided by Henry's dad documents only 2 appropriately timed doses of MMR vaccine administered at 1 and 4 years of age. So is Henry's immunization record compliant to attend school, yes or no? And we'll give that a moment here for you to respond to, and then we'll show the results. Okay, so 60% of you got that correct. Henry's immunization record is not compliant to attend school. So let's unpack that a little bit. Next slide. So this is a example of our official Colorado Certificate of Immunization with Henry's immunization record. You can see the header here, required immunizations. There's a number of immunizations required for school, Hep B, DTaP, that are not completed here. And he's only got those doses of MMR and no other documentation. Next slide. So to understand immunization compliance, the vaccines that are required, the timing and spacing, it can be a lot, especially if you're new to this information. And so we publish on an annual basis childcare and school immunization tables. These are linked on our professional pages and also translated into Spanish. These resources summarize the law and use the evidence-based recommendations for the immunization schedule. We also want to note that following the immunization schedule avoids the need for in-process plans, which can involve multiple trips to a healthcare provider or submission of a non-medical exemption out of necessity or convenience rather than a true desire from the parent. Next slide, please. Okay, so we're continuing on our scenario. The school nurse notifies Henry's dad that he's missing immunization documentation for the other school-required vaccines and cannot attend school until Henry is in compliance with the requirement. Henry's dad goes ahead and makes an appointment with their pediatrician. His pediatrician recommends catching Henry up for all routinely recommended vaccines due now. He's 9, he's only got the MMR series. So Henry receives vaccination at that visit for Hep B, Tdap, and polio vaccine. For these vaccines, what documentation does a school need to comply with the immunization requirement so Henry can attend school? And we'll open another poll and give you a few moments to consider that. And after you've given that some thought, have a good response. Sarah's going to show the results. Okay, excellent. The majority of you got it, both A and C. So let's discuss. Next slide. So parents and guardians are responsible for providing immunization documentation to their child's school. So that would be that immunization record for the vaccines that were administered at that time. Now we know that we need multiple vaccines to complete the series for Hep B, polio, and tetanus, diphtheria, pertussis containing vaccines. So then he also needs an in-process plan signed by the healthcare provider, showing that he's catching up with those, hopefully those appointments documented and scheduled for those missing vaccines following the minimum intervals described in the catch-up schedule. To support families, schools can have access to the Colorado Immunization Information System where they can look up records and information as well. Next slide. Okay, and our final scenario here. So despite a strong recommendation, use of motivational interviewing to address concerns by Henry's healthcare provider, Henry's dad decides that he just doesn't want Henry to receive varicella vaccine. So for varicella vaccine, what documentation is required to comply with the immunization requirements so Henry can attend school? And we'll launch the poll. We'll give you a few more moments to think about that. Okay, and our results, excellent. See, a certificate of non-medical exemption. So we'll discuss that a little bit because this does come up quite a bit. Questions from schools, parents. Next slide, please. So this is, of course, first assuming there's no medical contraindication that would exclude Henry from receiving the varicella vaccine. The option available is the non-medical exemption, a certificate of non-medical exemption. It has to follow Colorado's process and be documented on Colorado's form. So sometimes we do get a letter from a healthcare provider or an out-of-state certificate. That does not suffice. It has to be on the Colorado form. Next slide, please. And a final note on exemptions required to school for exemptions to school required vaccines. So for non-medical exemptions, there are two ways families can obtain a non-medical exemption. The first is by the online immunization education module, doesn't need the signature of a healthcare provider. The second way is obtaining the signature of the child's healthcare provider who meets the criteria to sign and is willing to provide the immunization consultation and sign. There was a note or question in the chat about certificates of non-medical exemption expiring. So they do. And on our webpage, we have this handy table. It's color-coded. In the preschool population, non-medical exemptions expire when immunizations are due. So we break down those scenarios. So at 2 months, a non-medical exemption will expire at 4 months. At 4 months, well, 6 months. So you can kind of go through there, figure that out. In school-age children, non-medical exemptions expire on an annual basis. That is set in SIS, if the information is in there, June 30th, which is the official end of the school year. Next slide, please. Okay, and then I'm just going to zoom out a little bit and talk about Immunize.org's update of state immunization requirements and exemption policies for childcare in school. So Immunize.org annually updates their web pages based on information provided by U.S. jurisdictions. These resources can be really helpful for advocates, public health agencies, clinicians, families, and policymakers. In 2026, despite hundreds of vaccine-related bills filed in state legislators, there were ultimately very few changes to state immunization requirements for childcare, school, or college entry, which I think demonstrates there is continued widespread support at the national level for immunizations, immunization access, and school immunization requirements that, again, are a system of prevention supporting high coverage and low rates of vaccine-preventable disease. Next slide, please. So Immunize.org's website shows information updated in May of this year. They have some wonderful maps, tables, and exemption policies. There's some other related links on this page if you're interested in diving into these topics. Next slide, please. So this is an example of one of their maps detailing the state TDAP requirement for secondary school. And then accompanied to this map, you can dive into tables that go state specific, what the requirements are, how they differ state to state. Next slide. Similarly, you can look at exemptions permitted for school-age kids and looking at the different exemption types and the specific laws and policies in the various states. Next slide. Okay, handing it over to Rachel.
So in this next section, I will talk through some of our childcare, school, and college university immunization coverage data. So again, the data that I'm going to talk about is based on this annual reporting process where most schools, childcares, and colleges, universities in Colorado are required to submit aggregate data to the state once per year at some point in this reporting period from October 1st through January 13th, or excuse me, January 15th. And every year in late spring or early summer, we publish that data on a public-facing dashboard that you can navigate to from covaxrates.org. And a little later in this section, I will switch over to the dashboard and go through a brief live demo of how to access data from the dashboard. There's also downloadable data sets that you can access by downloading them directly from the CDPHE Open Data Portal. There's also API access, and there's data available in a few different categories. There's statewide, county, district, and individual facility level data. And those data sets correspond to all of the data points available on the dashboard. So we completed our 2025-26 data collection process earlier this year and published updated data on the dashboard earlier this year as well. And we saw that in 2025-26, our data for Colorado showed small decreases in kindergarten and childcare vaccination rates for all vaccines compared to the previous school year. We also showed small decreases in K through 12 vaccination rates for all school-required vaccines, except for Tdap. So among our kindergarten students, except for hepatitis B, where our statewide rate is 91.1%, our immunization rates for the rest of our school-required vaccines are all still below 90% for the 5th year in a row. And then finally, among kindergarten students, our coverage for school-required vaccines is about 2 to 6 percentage points lower than rates we measured in the 2019-20 school year, which was kind of our last checkpoint before the COVID pandemic. So this graph on the left is showing county-level kindergarten vaccination coverage, and we saw that in the 2025-26 school year, only 10 out of 64 counties had fully immunized MMR rates for kindergarten students at or above 95%, or that estimated threshold for community immunity. So zooming out a little bit and comparing Colorado to other states and national estimates. So every year, CDPHE submits specifically kindergarten vaccination data to CDC. CDC then publishes national and state level kindergarten vaccination rates on their school VaxView dashboard. The 2025-26 data was published on August 17th. So we saw for the 2025-26 school year, Colorado ranked 43rd lowest out of 48 reporting states for MMR coverage at 87.7%, which again is well below that 95% threshold needed for community immunity. CDC also publishes potentially achievable rates. So we wanted to take a moment to highlight our potentially achievable coverage in Colorado for MMR specifically. And how we define potentially achievable coverage is the estimated sum of up-to-date students plus students who are not up-to-date and do not have a documented exemption. So pretty consistently over the years, Colorado's potentially achievable coverage has always hovered around 95%. So it's an important thing to keep in mind that out of all of the students that we survey, if we were to add to the up-to-date students who are in process or have an incomplete record or no record, we could potentially reach 95% coverage. This graph shows Colorado's MMR fully immunized rates among kindergartners over time in blue compared to the corresponding US average in red, and then our target MMR coverage in the gray horizontal line at 95%. So we can see in Colorado and nationally a somewhat steady decline starting from the 2019-20 school year. But another thing to keep in mind when we're talking about this data is we are really talking about quite small changes, and the y-axis is pretty zoomed in. Here you can see it starts at 82% instead of 0%. So we also always want to end these kind of minute discussion about trends in vaccination coverage by zooming out and really emphasizing that the data that we collect shows that the overwhelming majority of parents still choose to fully vaccinate their children in Colorado and nationally. We wanted to link to an article by our colleague, Dr. David Higgins, about some of the dangers of exaggerating vaccine hesitancy when we are communicating with colleagues, parents, the public about vaccine coverage data. So I will go ahead and bring another web page over just to briefly go through our public-facing dashboard. So if you type in covaxrates.org into a web browser, it will redirect to our CDPHE dashboard webpage. And this is an embedded dashboard, and data is organized in tabs across the top of the dashboard. So the default tab that you see when you first refresh the dashboard is the statewide rates tab, and that shows statewide data organized into a few different categories. We have K through 12 rates, kindergarten rates, childcare and preschool rates, and finally college and university rates. So in each of those statewide sections, when you scroll down, these top two metrics show the overall compliance rate, so students who are fully immunized, in process, or have an exemption across all vaccines, and then the enrollment for the corresponding most recent school year. In the table, if you scroll down a little bit, there's vaccine-specific metrics for each school-required vaccine, and then within that table, those are broken out by fully immunized, in process, exemptions, so combined medical and non-medical exemptions, and then non-compliance. By default, over time, the dashboard shows summary compliant metrics over time. You can click on any of the cells in the table to see that corresponding metric over time. So to see statewide K through 12 MMR fully immunized rates over time, I can click on that cell. To see polio exemptions, I can click on that cell. And in the graph over time, the data is broken out by the percent of non-medical versus medical exemptions. Similarly, for non-compliance, the data is broken out by students with no record versus an incomplete record. On the next few tabs, the K through 12 rates, kindergarten rates, and childcare and preschool rates, you can see data organized in a really similar way for individual schools and childcares that reported data to CDPHE. So for each individual school, you can navigate to different schools by using the drop-down menu. And similarly, you can see different data elements over time by clicking on the corresponding metric in the table or clicking on compliance in this top level row. Something to note when you're looking at individual school data is when you see missing bars for certain years, that indicates that the school didn't submit data to CDPHE for those school years. So that could be that they weren't open for those school years, or that they did not meet the reporting requirement and we didn't receive data from them. And then on this school through 12 page, you can also toggle between seeing K through 12 data or data at the district level. I'll move over to the county and district rates tab. So this tab shows data geographically. You can change the map to show data by school district or by county, and then also toggle between K through 12, kindergarten, and childcare and preschool data. You can choose the corresponding school required vaccine, the vaccine metric, and the school year. And if you scroll down a little bit, you can also see this corresponding data in bar graph form in order of the corresponding metric. And then finally, on our last tab, we have college and university rates by individual colleges and universities that have reported data to CDPHE. And on this tab, you can toggle between MMR and meningococcal data. So, and then one last thing that I wanted to mention that I think I also have a slide on this, but if you scroll down to below the dashboard, there is a button that will navigate you to the CDPHE Open Data Portal, and this automatically takes you to all of the available downloadable data sets that correspond to our school, childcare, and college university data. Okay, I think I'm going to pass it back to Sara.
Thanks, Rachel. Okay, so we'll be talking about some summary strategies for a successful back to school season. Next slide, please. So when health inspectors visit schools and child cares, they often conduct their inspection and ask schools to consider some questions to understand their process for collecting immunization records and performing compliance. So we're going to be going through each of these ones with some reflections in the following slides. So next slide, please. So Rachel, next slide, please. Thank you. So the reflection, the first is what is our process to support schools to collect and maintain immunization records and immunization documentation more broadly. So the first thing that we want to note here is that providers are required by law to document immunization and exemption information into the Colorado Immunization Information System. So there is a really robust amount of data in SIS, and schools can have access to that. Of course, they take training and they have to abide by all the privacy, confidentiality requirements that healthcare provider would with using this. Schools that are interested and access that don't have it can email our SIS school coordinator at the email on the screen. Schools, of course, must require records to be on site before a student's first day of school. And then schools should have a strong process for conducting that initial and ongoing immunization documentation review. As you gathered, I hope, from the initial part of this presentation, is that students can provide, families can provide immunization documentation, but a non-medical exemption could expire or likely will expire. And then kids just are due for vaccines. Maybe they're missing or catching up. So they may fall out of compliance as the school year progresses. And then providers in schools should, of course, communicate with families to improve understanding of the requirements so that they're prepared to provide the school what's required and not interfere with the students' attendance. Next slide, please. So one way to communicate this requirement is CDPHE's annual parent letter. This is a requirement in statute that CDPHE annually updates a communication that explains the requirements for school entry. Then by law, schools are required to directly distribute this letter to the parents and legal guardians of every enrolled student in K through 12 or childcare between January 15th and April 15th. Then schools and providers can share the letters as needed throughout the year outside of that required time frame. There are two versions of the letter. There's a childcare version and a school version, which are available on our web pages in 15 languages. Next slide, please. So the second question or reflection, how can we support schools to have up-to-date records and families? So each time a vaccine is administered, providers should share the updated certificate of immunization, or at least the immunization record, with the student's parent or guardian. Certificates of immunization, that's the official record or school record that's required, can be generated through SIS. Schools should also have a system to track when immunizations are due, and staff should be trained on compliance and use CDPHE resources. Schools, if they note that, or when they note that a student is not compliant with the requirement, should send a direct notification to the parent or guardian. Schools can use the optional notice of immunization requirement form linked on our A to Z topic index webpage. Next slide, please. And then this is an example of our new A to Z topic index webpage for school requirements. It has the forms, it has a lot of information, maybe just a quick guide to supplement the main homepage that Rachel shared earlier. Next slide. So what steps should we follow? Schools follow if a family does not provide immunization documentation, or if vaccines are overdue, or the non-medical exemptions expired. Well, schools are required to enforce the law. So, of course, if a student is not in compliance, like the example with Henry, they can't start. But for a student who's attending and they fall out of compliance, the school has 7 days to provide direct notification to the family. And then the family has 30 days, an in-process period, and to get immunization documentation to the school. If that doesn't occur, the student must be excluded from school or childcare. We have a notice of exclusion form, again, linked on our webpage. That's optional if that's a way that helps schools communicate with families. Before we move on from this slide, I want to note that there are special protections that apply to indigent children. This is a term that's defined in the Board of Health rule, and children eligible for McKinney-Vento Homeless Assistance Act. These children are offered additional time and resources to come into compliance before they are excluded for noncompliance. And so those protections are, again, outlined in the Board of Health rule. Next slide, please. And then this is the statutory language, or the language from the statute in 254907 regarding exclusion if schools want or need to share that with their leadership or have questions. You can refer those as needed to our team email listed on the screen. Next slide, please. And then a final reflection, and this is, one that I think we are having, at the state level, is focus on a kindergarten cohort. So, and, the data that Rachel shared, and I think we'll share around kindergarten data, is that we report it to CDC, it's published, it's very visible. And the reason why is it's a predictable, consistent, high-impact checkpoint to evaluate the vaccine coverage. And it can also mark the first time that many children are entering the formal education system. They may have been attending childcare and facility that's exempt, maybe a family and friends childcare, or didn't go to childcare or licensed childcare where the immunization requirement was present. Also, those final doses of Hep B, DTaP, polio, MMR, and varicella vaccination series, they're due prior to that student's first day of kindergarten. So kids that are up to date and following the schedule. There isn't another immunization requirement for them and for school until they reach 7th grade, and that's the Tdap vaccine requirement. The percentage of kindergarten students who are not in compliance with the school immunization law, as Rachel showed, that means those with incomplete record or no record, has consistently measured about 90%. So there's 10% of students when the data is reported by schools to CDPHE and published, there's 10% of those kids where we just don't have the information to say, that they're immunized or not. So that definitely impacts the rates at the state level. So improving our data completedness for this cohort can improve our ability to protect children from, again, vaccine preventable disease outbreaks. Next slide, please. So we wanted to provide this call to action for kindergarten immunization data ahead of the school reporting for the 2026-2027 reporting period, which, as Rachel mentioned, opens October 1st. It closes January 15th. And while all immunization data is important and has value, this kindergarten cohort is something that we're definitely interested in improving, and we feel like we can improve with just better visibility of immunization records in this group. So if you're a provider that's caring for kindergarten students, or if you're a school and that's part of your responsibilities is immunization data review collection for the kindergartners, we're really interested in trying to get as many records as possible and really decrease the non-compliance rates for this cohort. Next slide, please. Okay, I'm going to hand it off to Rachel.
Thanks, Sarah. We wanted to end by sharing some additional resources. The immunization requirements for school entry webpage, the A to Z topic index webpage for school immunization requirements and related resources that Sarah mentioned, and then the covaxrates.org is our public-facing dashboard that I showed a live demo of. There's some additional vaccine resources linked below on this slide as well. We also wanted to share some relevant school and childcare help desks and contacts at CDPHE. We have a dedicated reporting inbox for our school and childcare immunization data reporting. That is a good contact for school immunization reporting and data questions and reporting support. We have our school and childcare nurse consultant, Sara Lopez, for vaccine-related clinical questions and school vaccine policy. Our vaccine administration clinical support, or VAX, inbox is a good contact for vaccine-related clinical questions. Our CIS school coordinator contact is good for CIS technical support, non-medical exemption needs regarding the online immunization education module. And then finally, our CIS help desk is a good contact for CIS technical and user support. And that's all we have. Thank you so much for your time and attention, and I will pass it back to Sarah.
Great. Thank you both so much for that incredibly informative presentation. If anyone has additional questions, feel free to pop them in the chat or the Q&A. We have a good amount of time to go over a few things. We did get some great questions throughout the presentation. So first one in the Q&A, I'm just going to go in order. Is there a Spanish version of the in-process plan available?
Hey, Mary. There is not a Spanish version of that in-process plan since it is going to be signed by the healthcare provider and provided to the school for compliance. If that's something that schools or child cares feel like it is missing or is a gap, we can consider that request, though.
Wonderful. Thank you. Next up, do homeschool students affect the school immunization rates at all? And then this person wants you to know that they are pro-vaccine for all students.
Thank you. Yeah, that is a good question. Speaking here, but we do are registered with an official school district, and the students' vaccine info should be reported to the district as part of the homeschool's compliance with immunization law. With that said, since we receive aggregate data with no student level information, we don't have a good way to determine what percentage of our survey includes homeschool students and what percentage of that overall population in Colorado we're actually receiving data for.
Rachel, your sound cut out a little bit at the beginning, but it sounded like you said homeschool students are technically required to register with a school district. Is that correct?
Yes, thank you, Sarah. That is what I said.
Perfect. We could mostly fill in the gaps.
Yeah.
Okay, thank you. Next question, just with an increase in vaccine hesitancy, how do schools know that children are getting, for example, the full MMR vaccine series if they're only required to submit vaccine records when they enter the school at kindergarten?
So I want to clarify that. So for licensed childcare centers, if children are attending, the immunization requirement exists, and they need to provide immunization documentation upon entry, and then anytime that they receive immunizations, which hopefully is following the best practice immunization schedule. And so they're aware of that over time. I think our childcare rates are quite good. We have good data. The child cares do a fabulous job with immunization compliance and notifying families when immunizations are due and getting kids to get into their healthcare provider, because they're not only just getting the immunization, they're there for their well child check and getting assessed for other things. Parents are getting a lot of great education during those visits, and getting questions answered. So, but for kindergarten entry, they should have 2 doses of MMR to start. And so on the immunization schedule, if you're familiar with it, you'll know that the final doses of varicella, MMR, DTaP, and polio, there's a range, age 4 to 6, that kids can get that. For school in the state of Colorado, the requirement is for these kids to start kindergarten, they need those doses before their first day. And so we have information that they are hopefully immunized before they start, or if they're choosing not to or can't because of a medical reason, they have that medical exemption on file, non-medical exemption on file. And then, many schools do require immunization documentation on an annual basis, but for kids that are up to date for all their school required vaccines, that stays with them from year to year. There's not additional doses of those school required vaccines unless a student was behind catching up, missing doses.
Great, thank you.
Sarah, just to clarify on the homeschool student thing, because it's a little tricky in the rules. So if a student is going to be attending for a portion of the day, they need to provide their immunization documentation to the school if they're attending a school district for a day a week for a few hours. That immunization record does have to be provided. Otherwise, it's the information for the homeschool program. They're affiliated, supported by the school district. That information can be sent to the school upon the school's request, and there's just some kind of nuance in that requirement, which if anyone has more questions, I'm happy to share after.
Perfect, thank you. And yeah, you all do a great job of covering the majority of folks, but then there's always going to be a few exceptions. Everyone's an individual. So with the Q&A, I'm going to jump around a little bit just to kind of give us a little bit of a train of thought here. So this one should be a quick one, just asking about when the Tdap dose is due. Sounds like they're asking if it's due for incoming 7th graders now instead of incoming 6th graders.
Yes, so the Board of Health rule changed we went to rulemaking last December. These rules were in effect starting in February of this year for a rollout, with the Tdap vaccine requirement changing from 6th grade, as it was historically, to 7th grade, starting with this current school year. So the cohort of students who were compliant for Tdap last year will hopefully be compliant this year, as they are now 7th graders. And the change was made just to better align the vaccine requirement with the student age and the age that that vaccine is recommended, which is age 11 to 12 years.
Perfect. And then one more just kind of process question. This person is just clarifying. So for any vaccine due within a range, i.e. like 6 to 12 months, then they can get that vaccine at any time during that period. Is that correct?
Yeah, that's correct. And they would only be, overdue. We have that documented in our preschool immunization table. So, like, say, vaccines that are, we say by blank months of age, the child is required to have received this number of valid doses of vaccine. So we give them into that next month following the due, the end of the range when it's due.
Yeah.
I'll drop that table. It's very clear there.
Thank you. And then we get into we have a question about flu vaccines and then another question about kind of changing rules and regulations. So I'm going to leave that one for the end. But just, do you have a recommendation for flu vaccines? I assume they mean kind of like, does CDPHE have a flu recommendation for flu vaccines for students and teachers? And then how do we get our school community to set standards around flu vaccines or seasonal immunizations?
Oh, that's a great question. So for influenza vaccine recommendations, the American Academy of Pediatrics just recently released their vaccine recommendations. It's not a lot of changes than what we've seen in prior years. So anyone 6 months of age or older without contraindication to receipt of a flu vaccine is recommended to receive a dose. Adult specific recommendations will be coming soon from the American Academy of Family Physicians, AAFP. Sorry if I have wrong. So we expect those in the coming weeks, actually. In terms of setting community-wide or school-wide, supports or systems to improve flu vaccination, I think it's educating on the importance of flu vaccine. We had a pretty bad flu season last year. Every year is unpredictable, and even healthy people, including children, can get influenza and have poor outcome. The influenza vaccine continues to work well. It's not as good, unfortunately, as some of our other vaccines, and it's still possible to get influenza if you were vaccinated, but also the studies show immunized people often have less severe illness. So if it doesn't completely prevent, it's very likely it's going to reduce the severity of illness. So I think continuing those messages, and then I think working with people who are trusted in your community. That's really what's working with vaccine confidence, is talking to people who people trust.
Yeah, and shameless plug here. Immunize Colorado has some great resources around the flu vaccine. I know that's a really tricky one since it's every year, and there's a lot of really common questions that people have about it. So we have that Parents Talk Flu Edition campaign that's going to be launching soon. That's going to be kind of highlighting parent perspectives on the flu vaccine. And then we also have those motivational interviewing trainings where we can talk your team through best practices and how to kind of address those common flu vaccine questions. And then we have one last question in the Q&A before we wrap up. So how can we get rules or regulations updated to allow schools to accept exemptions that are seen in SIS instead of requiring the paper form from parents? And I save this one for the end because there's a lot there.
Yeah, so Thank you for the question. And I think what this, alludes to is that CIS only can contain exemption information, and the requirement in the law is for a school to have an immunization record documented on the certificate of immunization, or a certificate of non-medical exemption or medical exemption for those doses of missing school-required vaccines. CIS cannot generate that certificate, and so I think it's been explored. It would be quite costly for that to generate, and I think that there's some barriers with that. So I think if you have questions or concerns with the Board of Health rule, we do have a policy team. You're welcome to reach out and provide that feedback. And I can find the link here quickly.
Perfect. Thank you. I am gonna share my screen and just pull up a couple of last kind of announcements. But in the meantime, Rachel, Sarah, thank you both so much for this great presentation. Here on our screen, we have just a shameless ask for donations. So as you know, Immunize Colorado is a nonprofit. We rely on a lot of different funding sources to keep us going. So if you enjoy educational material like this, every little bit helps. So thank you for your consideration. And then last, we just have our post-webinar survey. It really, really helps us if you take these. Just kind of helps inform future webinars, events that you'd like to see, and what you'd like to learn about, so that we can make sure we're addressing what everyone needs. So I put a link to that in the chat, and there's also the QR code up on your screen. Besides that, Rachel, Sarah, thank you both so much for this great presentation. I feel like I learned a lot, and I'm sure our attendees did as well. A reminder for those left on the call, this was recorded and it will be posted on our website within a week, along with the slides, because I know there were a lot of really great links and resources in the slides. So yeah, just be checking our website and it'll be up fairly quickly.